All right, everyone, we're going to go ahead and get started and be mindful of everybody's time. Thanks for joining us this afternoon. We've got a didactic from Rhonda Edmonds and Alicia Bowman, who's joining us as well. So please, feel free to use the chat for questions during the presentation. We'll keep track of those. And then after the presentation, we'll have a discussion. You can use the chat, raise hand feature, or just unmute. And if you haven't done so already, let's make sure we're putting our info into the chat for attendance and introductions. And if there's any technical questions, also please feel free to message me at any time. So without further ado, Rhonda, I will turn it over to you to share your screen and take over.
Okay.
All right.
See if I can do this again. Oh, that was much easier this time. So, well, I am Rhonda Edmonds, and I am the Director of Nursing here at Lily's Place. And my co-presenter here is Alicia Bowman, and she is one of our peer support specialists. And we work together to do this prenatal education for the mamas. So we are both a little bit nervous. We're not big presenters, so you all bear with us. Okay. So Alicia and we started thinking about this like several years ago now, that we were seeing such a need for this, in that we were having moms that were bringing their babies to our facility. And so we were having these interactions with them. And of course, they were very hormonal. They were sleep deprived from just having a baby. They were all in recovery, and we're feeling just very overwhelmed with this whole experience. So they had even felt like they were blindsided by some of the different circumstances around the birth of their baby, and just felt unprepared and absolutely terrified of what was happening. So these are some of the concerns that they had told us, that no one had told them that their baby could withdraw from them being on Subutex or Suboxone or even methadone. They never knew that their baby had to stay in the hospital for at least 5 to 7 days to be observed. And they didn't know that they could breastfeed while they were on MAT. And they had no idea that if they wanted to breastfeed, that they needed to provide their drug screens before they were allowed to do that. And of course, they were terrified about CPS. So because they did, the word gets around that they were going to have a CPS referral. And we wanted to help them through this whole process. So we developed the Lily's Place ABC program. And the ABC stands for Antepartum, Birth, and Continuing Care. And it was created just to meet these educational needs that the moms had, that the expectant moms had. And we wanted to empower them with this knowledge to be the first line of treatment for their baby, because we learned through the years of taking care of these babies how important the families are, and particularly the moms are, to these babies getting through this process. We wanted to facilitate healthy bonding and early attachment. And we felt like that the more bonded and attached mom and baby were, the better care that she was going to take care of this baby in the long run. And really the biggest thing was, we wanted this to be a time of joy and excitement for these moms, because we felt like that they were kind of being robbed of that because of all of the fear and anxiety that they were experiencing. And having a baby is supposed to be joyous, and we wanted them to be able to have that experience as well. Alicia, I'm waiting for you to chime in any moment.
No, just one thing. So yeah, as a person in long-term recovery, I can relate to just the feelings of being overwhelmed and frightened, and all of those things that they were describing to us. Any one of those things could be detrimental to a person's recovery. Especially if you add that in with the chemicals that are trying to regulate and the hormones that are adjusting, that a woman experiences right after giving birth. So, I mean, it's not only a scary and robbing them of the joy that is supposed to be having a baby, but it was also a threat to their sobriety. And so, it was also important. It's also important in that aspect to give them the knowledge and inform them of what to expect, so that way they do not experience those feelings. You go to have a baby and you have no idea what the terms are, or the lingo, the doctors, the Finnegan score, all of these things, all of these words can be scary if you don't know what to expect. And so we just try to give them as much preparation into what is going to take place at the time of delivery and thereafter.
So what these classes kind of look like is we have been invited to some of the MAT programs, and they pull the expectant moms out into a group, and we can meet with them there. We can also meet with moms individually. We have a group of moms that is from another program, and that we can also have moms come to that class as well. And our goal is not to just spill out all this information to them. We don't want them to come in for this big lecture and us just stand up and talk and with our whiteboard and all that. We want to get to know the moms and help them to feel comfortable so that they can ask questions. And we know that if we just get up there and spill out all this information, a very small percentage of it is really going to be retained. So if we can make it a group setting and make them comfortable, we have snacks and that kind of stuff, then they're going to hopefully retain a lot more of the information.
We develop relationships with each and every single mother that attends our class. We get to know them and they get to know us. And in doing that, they trust us. And by trusting us, then they listen to what we have to say. And so I think that really helps. Not only they are adding to their knowledge of what to expect, but they are also adding support to their toolbox for recovery. So it is, I've had moms from previous classes that, after birth didn't know the answer to a question, or needed to know what kind of formula should, what kind of formula do babies normally get whenever they have NAS, or just they feel comfortable enough to reach out in this time. So the friendship and the relationship that we develop with the moms, I think, is key to getting them to absorb the knowledge that we present to them.
So who's involved in these classes? Well, we have an RN, which is me, that has worked with these babies and presenting the information. And we also have Alicia there as the peer support specialist, which I think is vital for the moms to trust what you're saying to them. She's been there, not had a baby with NAS, but she's been there in addiction and recovery, and they just can relate and feel comfortable being around her. Of course, we also have the expectant moms, and then one of our groups has moms that have already delivered their babies. So we feel like that the moms who are expectant can learn from the moms that have already delivered, and they can, be like, oh yeah, don't be nervous about that, or just make them feel more comfortable. And then sometimes in our groups, the counselor or peer support specialist from that MAT program will sit in on the class as well. Got anything to
Yeah,
add to
I
that?
think that class is really special as far as the moms who have delivered already, being able to just that peer-to-peer information on what they have just experienced. And I think that it helps out a lot for the moms who are still expecting.
And what we've started doing in that class is we'll have like a little tip of the day, and it might be like summer safety with sunscreen and that kind of stuff, so that we can still have them a little tidbit of knowledge too, and not just be all about the pregnant mamas. But they really like to stay together and just talk about their experiences. So we enjoy that class. So some of the topics that we discuss is like labor and delivery. We want to talk to them about the importance of their prenatal care and developing a simple birth plan, nothing that is very intense and intimidating. But, who is their support person going to be? And do you want that person to cut the cord or not? Things like that. And then birth control options, because, what if it's something that needs to be started immediately? Then we want them to already have that plan. And we want to teach them about creating that therapeutic environment so that they know that as soon as that baby comes in the room with them after birth, that we want them to put that baby skin to skin. We do talk about the golden hour that they do at the hospital right after delivery, where the baby is put on mom's chest, and we talk to them about rooming in and safe sleep, and even defining NAS. I mean, that's something that we just say that all the time, babies with NAS, and it's like, what is NAS? So we have to really break it down so that they know what we're talking about and they're familiar with those terms, because I know as a nurse that we're all guilty of that kind of stuff. We just think everybody knows what we're talking about because it's so familiar to us, but oftentimes it's not. I remember in one group, actually, Dr. Price, this was in one of your groups a long time ago, I said in utero, and one of the moms was like, "Look at you using those big words. What are you talking about?" And I was like, "Oh, okay, yeah, you're right. I need to just, get not so familiar with my terminology, but with other people's terminology." So we want to talk about the treatment of the withdrawal. And of course, we want to focus on the non-pharmacologic first, with the mom being that first line of treatment, and the environment. And we go over the therapeutic handling techniques, and we talk about the Finnegan score and the Eat, Sleep, Console. And then we also talk about the methadone or other pharmacology that might be used in the treatment for the baby. And then things like feeding. Do you want to do bottle feeding or breastfeeding? And then the whole cue-based, that we don't have to feed babies on a schedule, that they let us know by these subtle signs that they're hungry. And we also want to talk about baby blues, and when the signs that mom needs to call the doctor for herself. And then also Brain Under Construction. That's a program that we really like, and just talking about developmental play for mom and baby, if talking and singing and reading a book, and how to pick up on your baby's cues that might be overstimulating for them. So you don't, you want to look, are they looking away, or do they have hiccups? all these signs so that this can be a good interaction between mom and dad and baby. And we have had one dad, speaking of dads, in our program, and we would like to see more dads in our program, and even have a dads group would be great. So if anybody has any referrals there. Anything you want to add to what we teach about?
So yes, we actually also go over CPS, and seems to be
Very important.
whenever we have our first group, we always ask them, what is, when you think about delivering your baby, is there anything that scares you? And so we can get that and kind of calm those fears right out of the gate. So, and almost 9 times out of 10, the answer is always, I'm terrified of CPS. And so our goal with that is to inform them as much as possible that, CPS is, their whole job is to help the families stay together. And everyone views CPS as being like a monster in the dark, and they're terrified. So a lot of times, especially, there have been a couple of times that I have, after the baby has been born, if I'm still working with the families, that I will just immediately after birth, like, set up a meeting with the CPS worker on the case, and just introduce them to each other. Say, hey, this is, she's, and they become more human. Not only does the CPS worker become a human to the mother, but it just kind of gives, I don't want to say, our CPS system is extremely overwhelmed. They are very busy. Names come across their desk, and it just kind of makes this family, this mother, more than just a name across the desk. And it kind of helps develop that relationship between CPS worker and mom. We have actually also started something new to help them be prepared for CPS, and that is our little black books. And little black, I don't have one to show you, but they are binders that we give out during the beginning of our prenatal class. And inside there are dividers, and in each section, the mother can put all the work that she's been doing throughout the pregnancy, throughout her treatment. That way, when the CPS worker comes to the hospital, she can hand this binder to the CPS worker and show them all the things that they have been working on. So like there's meeting sheets in there where they can get signed to every meeting that they've attended, or groups. There's a recovery, a WRAP plan that is included that we give them that they can fill out. So the Wellness Recovery Action Plan that they fill out on their own. Reference letters can be put in there. Their urine drug screens for however long that they've been in treatment. Letters from the programs they are in. Letters from people that they have been working with throughout the pregnancy. And a plan for discharge if they are in a program like inpatient, or a plan for discharge from the hospital. What are the things that these are the things that I'm going to do to ensure my recovery after this is over. And so what that does is show to CPS that they are prepared. They have taken the time and they have put in the work, and it kind of lightens the load for CPS to have to do all of the digging and finding out and investigating. They already know this is everything that they've been doing. Here you go. And it's a big help. It's a big help. So we're excited to see how that plays out. We haven't had any moms deliver yet that have used this, but I think it's going to be great. So That's all I have, I think.
Well, and speaking of CPS, we can also talk to the moms about, like, if this baby, if she knows that, because of either prior CPS cases or whatever, that it might be, the worker might be inclined to place the baby with someone while she's finishing her, whether it be inpatient or is ready to take the baby home herself, then she can start thinking about who those people might be in her life and have those conversations before it's a emergency kind of thing, that I've delivered this baby, they're telling me I can't take it home, and who am I going to take it with? It takes away some of that scariness and that urgency of it, that we planned for this. And I just feel like anything that we can do ahead of time. And we had one girl in our class that it was very early on, and or Alicia mainly was able to work with her and secure housing and found dad a job and those types of things, so that by the time the baby was delivered, they were set, and it wasn't a crisis situation. The length of our program. We have 8 scheduled classes to complete. And sometimes, I'm sure we're going to be adding to that because we kind of have already. But as I said earlier, some of the classes have only pregnant women in them, and then sometimes they're pregnant and postpartum mamas. And the class is usually about an hour long. And like I said, we have group setting. It's me and Alicia that are doing these classes, and snacks are very important. We can now have snacks since COVID is in the past. And we do these evaluations at the end, once the classes have been completed, and we do a short little survey, and everything we tried to cover everything in like 7 or 8 questions, ranging from the organization of the class to how prepared did you feel like you were in having your baby. And everybody has had positive things to say, and say that they would recommend it to a friend. And Alicia, do you want to do the case study or read over that?
Yeah, I can.
Okay.
So the case study, the mom was 42 years old. Her oldest child, her other child was 21 years old. So it had been a while. She was not in addiction or recovery at that time. She has been on MAT for 2 years with no slips or no failed drug screens. Her biggest fear prior to the prenatal class was CPS. She had heard lots of horror stories. Outcome for the baby, she was able to room in on mother baby unit and then in the NTU pretty much exclusively. The baby did not require medication and was discharged home from the hospital on day 7. When asked, how did this class help you? She said that it prepared me for everything that was to come. It was still a little bit overwhelming, but I can't imagine how hard it would have been without the prenatal class. I was able to enjoy being a new mom. I felt more confident that I had been doing the right thing, and I no longer beat myself up about being on MAT. That is something that we hear a lot. The moms that are on the MAT wanting to hurry up and come off of it during the pregnancy because they feel like they are, one, either harming their baby, or if they come off of the MAT, then they won't have to deal with CPS. So we try to touch on that a lot. When asked, do you feel that having this knowledge could have impacted how well the baby did? Her response was, yes, I know I would have been stressed out and my baby would have picked up on that. I I feel like breastfeeding made a huge impact, and without this class, I would not have known about the need for my drug screens and the stress I would have felt without all of the information that have hindered ever being able to breastfeed successfully.
So I felt like with that situation that, and she's just one of many, but I just, you know, once the baby's delivered and everything goes well, then we're like, yes, that was a win. Because that is, like I said, that was our main goal, was to make sure that moms knew this stuff, felt prepared, and that this could have positive. So we were wondering if there was any questions with this. And then I have just a little snippet PowerPoint about our parenting class that Alicia and I don't do that, but we do offer it here at Lily's Place. But are there any questions about this part?
Don't be shy now. Put your questions in the chat, or just unmute if you have any questions or comments. Rhonda and Alicia, thank you so much. That was great. You did great. So we appreciate it, but I'm sure there are comments and questions.
Mainly, I'm just curious about something. Are you guys, is it a requirement for people to have their drug screens to be able to breastfeed? I just find that very like an interesting barrier for them to have to provide that to be able to breastfeed.
Currently, unless something has changed in the past month or so, at Cabell Huntington Hospital, they do have a policy that you need to have 90 days of appropriate screens in order to breastfeed. So that was something that we had a couple moms that, of course, didn't know about that. And then we had a mom that delivered on a Friday, and she didn't have her screens, and then getting her screens was a delay. So she missed that first like 48 hours of breastfeeding because of that. And that has been a little while ago that happened. So as far as I know,
I think is just to ensure that, you know, if they're in a recovery program, that doesn't always mean that they have strictly only taken their medication. And so if they have been in a program, but still using occasionally or failed any drug screens, you don't want them to have taken anything that could potentially pass through the breast milk into the baby.
I guess just the advocate for bodily autonomy in me is like twitching at a restrictive, very aggressive take on the UBM protocol. So I was just like, who is doing this to these people? This is horrible. I appreciate you helping to pull their strings together. Mainly, I was like, who has this restrictive policy? Oh my goodness.
Dr. Price, do you know if that is changing at all? Or?
My knowledge, that is how it is currently, and I don't know that there's any plan to change it. So one of the advantages of the MARC program is that where we have a shared EHR with Cabell, for anyone who's been in the program during pregnancy, it increases the likelihood that they'll have access to that information upon delivery. But then we really do a lot of problem solving around that policy. If we have folks, for example, who are relocating to the area from another state, or they may have entered the program later in their pregnancy. You know, if they don't enter until the last trimester, we're not going to have 90 days of screens. And so we do a lot of kind of cope ahead, making sure to continue, you know, to pump, to keep supply up. And we emphasize all the time, you know, this is the policy, but whenever you go home or whenever you go to Lily's Place, you know, it's a different thing. So we try to balance being adherent to the policy with helping mom not feel like she's completely shut down if she is not able to do that. we often use the phrase around here, whack-a-mole. It seems like every time we solve one problem,
You want me to go
something
ahead
else,
with
pops
the,
up somewhere else? Because before they, we did not allow breastfeeding at all, on the NTU, and so just I'm sure it'll be something else, not too long from now.
Mhm. Yeah, I feel like I think my internet connection is easy.
Yeah, you're back now. You were lagging there for a second. Ooh.
Okay. Yeah, I could tell everybody was freezing. But yeah, here at Lily's Place, we tried to do like everything that the hospital had done. But also, I mean, when I worked at the hospital, like years ago, we didn't realize, there's been a lot more research done about breastfeeding and MAT. So I feel like it is progressive, and hopefully it will be a policy that gets relooked at with the more research that's been done. Should I continue with the parenting video?
That sounds great.
I'm gonna stop my video because sometimes that helps with my internet connection.
Sure. Yep.
Okay. Okay. So we have a Lily's Place recovery parenting group. And again, we saw the need to start this because we were encountering families that were being required a parenting class by CPS, and we were having difficulty finding an available class. And we all know that the impact of substance use disorder on parenting and that parent-child relationship can be devastating. So we understood the reason why CPS was requiring this, but finding the difficulty of finding class. So we got started by reaching out to Prestera about a class that they had offered. And one of their people came and did like a 15-week class for us that we, sat in on. And then once that class was completed, they encouraged us to start our own. So we decided on the nurturing program for families in substance abuse treatment and recovery that would be a good fit for us. So what this class looks like is, again, it's a very interactive class. We can have 12 participants in the class, and it is a 12-week cycle. And these classes are weekly. Right now they're on Mondays at 11:30, but it's not one that you can just drop in and start in the middle. Like our prenatal class is kind of like, if you show up, then we're going to give you week 5, and then you can catch up on weeks 1 through 4 when we start over. But this class is not like that. You start with 1, and then you have to wait till it's offered again. It is offered at the Family Center. There are snacks. There is a graduation celebration, and you get a certificate of completion. It is recognized by CPS. So they have completed one course, one 12-week cycle, and had good response from that. And they just started a new one just a couple weeks ago. And all you have to do is, if you're interested or you have people that need to attend that, you can contact, is it Ashley now they contact, Alicia?
Yes.
At the Family Center?
Mhm.
So just call the Family Center and ask for Ashley, and she'll get your client on the list. So just some of the topics that they cover are about hope, families and substance use, communication, managing stress, schedules and routines, and just having fun. And the people who are involved are parents in recovery. There's a counselor that is over the class, and there's a peer support specialist. And sometimes parents even bring their children, and whether it be that they can't find childcare or whatever, but kids are welcomed. That was pretty brief. Any questions about that?
Thanks, Rhonda. If you don't mind stopping the share, that way we can see the Hollywood squares here and
Okay.
see who's got questions.
I do have to give credit to,
Sorry,
oh,
go ahead.
sorry. I want to give credit to Amanda and Dr. Price, Amanda Newhouse and Dr. Price for helping us develop some of this. So thank you. Thank you.
Yeah, I just have a comment more than a question. I think this is so important and sometimes overlooked. I think in our program, we kind of incorporate a lot of these concepts into the therapy, but it sort of takes away from the substance use therapy, but it seems really primary, because if people are trying to focus on what's happening next and their children and all of those stressors, they're not going to be listening to relapse prevention, right? I mean, they are in crisis mode. And so it's so important to deal with some of these fears. And I love doing it in a group setting. Sometimes that can have its drawbacks when everybody's in fear, but it can also be really, really powerful when they can share stories of hope and things that have gone well and share, their resilience. So I'm really glad to hear about your guys' program.
Thank you.
Yeah, and I'll say that, Laura and I have been talking about these things for a long time. So Marshall and WVU are on the same page, I think, about a lot of the types of education that we offer. That's not where everyone who's having babies with prenatal substance exposure is getting their treatment. In a sense, it's a good thing. A lot more of our moms that we're seeing come to the hospital have been receiving community-based treatment, but then they lose out on a lot of the opportunities for education that we have in-house here. I also think that with what we're seeing, at least in the Huntington area, with a large shift from drug of choice, a lot of moms that are not in MAT, who are in recovery and early recovery and still need all of this information, but just are not on buprenorphine, so they're not in a special program. And then also with residential, we've seen a huge benefit with Project Hope. Our moms go to this class. It allows them, for a lot of reasons, it allows them to kind of plug into the community and see one resource that's going to be available for them after they graduate. And then also, because when you think about like the cycle of how long things take, the medical cycle, the treatment cycle, and the legal cycle do not sync up very well. So you may have a mom who is really motivated in early recovery, in residential treatment, and knows that she will have a CPS case, but is not going to be assigned an individualized parenting worker for maybe another 6, 8, 9 months. And this is something that she can do to get more information, and also what Alicia was talking about, document that the efforts that she's been making all along the way.
I think you all did an amazing job for not liking presenting. So I think you guys did fantastic. But I love the little black book. Not so little, but I love it. I love the concept of it. And I love the relational framework that is so important. And I think a lot of the times we really miss that piece is, without that relationship, we're not going to get trust. But when you have that relationship and trust, you can really help motivate towards a lot of different things. So yeah, I love that piece.
Yeah, sometimes we admit that they get to talking and sharing and just, you know, telling us updates from the week before, that it's like, okay, well, we have to slide some information here. But we love that, the building of that relationship. And not all the babies that, like mamas that have gone through our classes, not a huge percent of them have actually had, you know, came to Lily's place. So there for a while, there were several that actually went home without the baby needing any medication. So, you know, that is awesome to think how just important that, I mean, they may not have needed medication anyway, but I'm just saying, I feel like that mother-baby relationship, you know, just, I like to think it made a difference.
Any other questions or comments? I agree with Amanda, Rhonda, Alicia. I think you're going to get asked to do this again because you did a great job. So get ready. But if there aren't any, we can adjourn early. That's no problem. We again really appreciate your time and doing this for us. The slides will be sent around to the group if they have questions. I did want to point out one administrative thing for ECHO, and this is going to be coming up probably in the end of August. But the mothership, the ECHO Institute in New Mexico, is implementing a new system for the projects. So no longer will you get a Zoom link that sometimes makes you register and sometimes will get you on the session. It'll be through this new system where you'll have to create an account and you'll have access to everything in there. The Zoom will be embedded within, so there's just like you click on it and that's it. More information to come on that. It is a big change. We're making sure all the functionality works on it. So like you can save the sessions to your calendars, you'll get reminders, you'll get access to the content there. It's supposed to be kind of a one-stop shop, and it's a little overwhelming. So we will make sure everything is working properly before you would ever get in the system. And then we will also do demos of the system. So how to sign up, all that stuff. So don't want you guys to freak out too much about it, but it is coming down the road, and we kind of don't have a choice. So yes, but more to come on that. Our next session is going to be on August 14th. So be on the lookout for more information for that one as well. And until then, please email me if you have any questions or any topics you would like discussed, or if you have a case, please let us know. All right, everybody. Thank you so much.
Thank you.
Yeah, thanks.